Your vagina, like everything else, changes with age. While normal changes in pelvic floor strength and vulvar skin thickness do not happen overnight, you may be able to be better prepared for them if you are aware of when and what goes down. Here as we show how your vagina changes throughout your lifetime and what you can do to keep it in the best shape whatever your age. The 20s vagina. The color of the vulvar skin will vary based on your unique genetics, but generally, the skin will be lighter in this decade than in later decades. The skin will likely not be as thick as it was in teenage years. Sex, contraception use, pregnancy, and birth are all factors that can impact your vagina during your 20s. During your 20s, your vagina does not suffer from natural lubrication. The only thing that could have an effect on this is if you're using birth control pills, which might reduce vaginal lubrication. Sexual drive and stamina are usually at their highest during this time as well. If you've experienced a reduction in lubrication after using birth control pills, suggest using a lubricant, to aid with uncomfortable sexual intercourse. The 30s vagina. Pubic hair and skin elasticity are largely the same in this decade as they were in the 20s, however, the skin may lose some elasticity and fat with age. A reduction in pelvic floor strength is one of the most noticeable vaginal alterations. Because the pelvic muscles support the bladder, uterus, and intestine, losing pelvic floor strength with age can result in a variety of problems such as urine incontinence, bowel disturbances, and a sense of vaginal heaviness. And vaginal delivery can exacerbate these symptoms in your 20s and 30s. There isn't much of a difference in your sexual drive and stamina levels. However, libido may be influenced by life circumstances, which may be more demanding in your 30s. This inability to disregard other duties may have an impact on sexual drive. Kegels and pelvic floor physical therapy before and after vaginal deliveries can train your pelvic floor muscles to contract and release more effectively, which prevents damage during delivery, assists in retraining your muscles post-birth, and decreases the chance of bladder and bowel issues, pressure, and prolapse. The 40s vagina. According to the North American Menopause Society, most women go through menopause between the ages of 45 and 55, with the average being 51. According to this information, many women will enter perimenopause in their 40s. Perimenopause is characterized by a gradual and erratic fall in estrogen levels. Think of a graph with multiple spikes that gradually diminish over time. As a consequence, life-altering symptoms including irregular menstrual cycles, vaginal dryness, and hot flashes can arise and modify your vagina. Reduced estrogen levels result in lower blood flow to the vagina and vulva, less collagen in vulvar tissue, and changes in vaginal pH, to mention a few effects. A woman's pubic hair may be thinning, her vulva and vagina may be drier, and her labia may seem looser owing to decreased fat content. Perimenopause symptoms, such as decreased vaginal lubrication, especially during sexual desire, and overall vaginal dryness, may have an impact on your sexual life. Aside from utilizing a lubricant to alleviate dryness, we recommend providing ample time for pre-intercourse foreplay and clitoral stimulation. Use a low-dose topical estrogen lotion if vaginal dryness continues. During this period, the vulva's skin is also likely to begin to thin, so avoid harsh scrubs and waxing, which can harm the skin. The 50s vagina and beyond. Menopausal changes include pubic hair becoming sparse and gray. The vulva, vagina, and cervix may also shrink in size, become lighter in color, and the skin may thin as estrogen levels continue to fall. As your estrogen levels gradually decline in your 50s, you may experience even less vaginal lubrication. If you're suffering vaginal dryness or pain during sex, we recommend increasing your foreplay and continuing to use a lubricant. In this video we did show vagina changes throughout your lifetime and how to keep your vagina healthy whatever your age. In the end, make sure to clean your vagina with warm water and unscented soap on a daily basis, and if you're suffering vaginal dryness or pain during sex, we recommend using a lubricant such as Vigorel or her solution gel. You will find the links for the official website below in description. Hit the links now to make sex fun again.